Today's nursing mindset is about infection prevention. One of the most important lessons you'll learn as a nurse is this: the best infection is the one that never happens. As nurses, our goal isn't simply to recognize or treat infections. Our goal is to prevent them whenever possible. That starts with understanding the chain of infection. In order for an infection to spread, 6 links must remain connected: the infectious agent, the reservoir, the portal of exit, the mode of transmission, the portal of entry, and finally, a susceptible host. Here's the important part. An infection can only occur if every link remains intact. That means we don't have to stop all 6 links, we only have to break one. That's how nurses think. Every intervention we perform should answer one question: which link in the chain am I breaking? Let's look at a few examples. When you perform hand hygiene, you're breaking the mode of transmission. When you remove a urinary catheter as soon as it's no longer needed, you're eliminating a portal of entry. When you administer recommended immunizations, you're strengthening the susceptible host. When you clean shared equipment between patients, you're removing the reservoir. Instead of memorizing infection control interventions, begin asking yourself, which link am I interrupting? That simple question will help guide your clinical judgment throughout nursing school and your nursing career. Now let's talk about another important concept. Oftentimes we think infection prevention begins with the nurse, but it actually begins with the patient. Your body is constantly protecting you from infection, even when you don't realize it. Your skin acts as a physical barrier that keeps microorganisms out. Normal flora compete with harmful bacteria and help prevent infection. Tears and saliva wash away pathogens before they can cause disease. Cilia in the respiratory tract trap microorganisms and move them out of the airway. Gastric acid destroys many organisms that enter through the digestive tract. Urine flow helps flush bacteria from the urinary system. Inflammation helps contain injury and begins the healing process. Every minute of every day, your body is working to prevent infection. As nurses, we ask another important question: what natural defense has been compromised? Has the patient had surgery? Now the skin barrier has been broken. Do they have a urinary catheter? The body's natural flushing mechanism has been bypassed. Do they smoke? Cilia may no longer effectively remove microorganisms from the airway. Are they taking broad-spectrum antibiotics? Their normal flora may be disrupted, increasing the risk of infections like C. diff or yeast infections. When you recognize which defense has been compromised, you can begin planning interventions to reduce infection risk. Of course, one intervention deserves special attention, and that's hand hygiene. It remains the single most effective way to prevent the spread of infection. Remember to perform hand hygiene before touching a patient, before clean or aseptic procedures, after body fluid exposure, after touching a patient, and after touching the patient's environment. One important exception to remember involves C. diff, because C. diff forms spores. Alcohol-based hand sanitizer is not effective. After caring for a patient with C. diff, or anytime your hands are visibly soiled, you must wash your hands with soap and water. Another concept students frequently confuse is positive pressure versus negative pressure rooms. Here's an easy way to remember them. Positive pressure protects the patient. PPPP. Positive pressure protects the patient. Clean, filtered air flows out of the room, preventing microorganisms from entering. These rooms are used for patients with severe neutropenia or those recovering from bone marrow transplantation. Negative pressure protects everyone else. Air flows into the room and is safely filtered before leaving the building. These rooms are used for airborne illnesses such as tuberculosis, measles, and varicella, helping prevent pathogens from spreading to others. Now let's finish with the most important question. After we've implemented our interventions, how do we know they worked? As nurses, we always reassess. Has the patient remained free from new signs of infection? Are existing signs and symptoms improving? Is the wound healing appropriately? Are laboratory values improving? Does the patient understand how to prevent infection after discharge? And perhaps most importantly, were we successful in preventing the spread of infection to others? That is the final step of clinical judgment. We don't simply perform interventions, we evaluate whether they were effective. Remember this final takeaway. Every nursing intervention should either protect a natural defense or replace one that has been compromised. When you begin asking, which link in the chain can I break, you're no longer memorizing infection control, you're thinking like a nurse. Every safe nursing decision begins with the right mindset. So let's keep developing our nursing mindset.